upcoding, billing for medically unnecessary services, and cloning health records. A new audit concludes all that was happening at Scottsdale Physicians Group.
It comes as the U.S. Department of Justice continues its investigation into the company of doctors that provided care inside Scottsdale's Honor Health Shea. ABC 15 investigators at Crenshaw digs deeper into the impact on the patients and your tax dollars.
Inside Honor Health Shea Medical Center in early 2022, an SPG doctor was caring for an 85-year-old woman. The medical records noted that for 7 of the 10 days, the patient is resting comfortably. But other reports documented that on all 10 days, the patient was moaning and stating her tailbone hurts. Also, those other reports had identical phrasing for all 10 days, stating the doctor spent 50 minutes each time with the woman.
That's a big concern because that's generally called billed but not performed. I find it hard to believe that patient was seen every day for such a long period of time.
Medical billing expert Michael Arrigo, who's not involved in this case, looked at the new audit that SPG's bankruptcy trustee commissioned after the DOJ filed a $589 million claim alleging the company submitted false and upcoded claims to get millions more in Medicare reimbursement.
A lot of people think Medicare is free. It's not.
In addition to the copy and pasted medical records known as
cloning of documentation,
the independent auditor also found billing irregularities. The auditor looked at a sample of 12 SPG doctors' coding over 2 years and reported that of the 119 inpatient services she inspected, every single one was sent to Medicare at the most expensive Level 3 code. But the auditor wrote, SPG's documentation did not substantiate the medical necessity of the level reported to Medicare for 89% of the encounters.
That's one of the highest percentages of non-medically necessary care that I've ever heard of.
The discrepancy also substantial for subsequent inpatient care, which is when patients have to stay in the hospital multiple days. According to the audit, the 2020 national average for Level 3 billing there was 46%. But SPG's doctors averaged more than 98% in both audited years. The report concludes, if the federal government were to do its own audit, it is probable that more than 90% of payments from Medicare would have to be repaid.
How can this happen? Well, unfortunately, medical billing is complex enough that it's not often discovered to be improper or fraudulent without a whistleblower.
Now, the trustee managing SPG revealed in court the company is going to shut down this June when it loses its contract with Honor Health Shea. Now, as the DOJ continues to try and prove its allegations, the big question here, who is responsible? The bankruptcy trustee wrote in a statement that, quote, all the federal claims took place under the management of Dr. Nima Ghadimi. I've repeatedly reached out to Dr. Ghadimi, SPG's founder and former president, but haven't heard back. I'm investigators at Crenshaw, ABC 15, Arizona.